Hello everyone. In the previous lectures, we understood that the different ventilation mode differ because they have different trigger parameters, target parameter, and cycle parameters. In this lecture, we'll understand what cycle means. For recap, trigger was the parameter which initiates the breath, target is the parameter which you use to sustain during the breath, and the cycling or termination was the stop signal. Cycle variable, when met, switches the breath from inhalation to exhalation. So different vent modes have different cycle parameters. In volume assist control, these are volume cycled breath. That means if you input tidal volume as 400 cc's, the ventilator will stop inspiration once 400 cc's achieved. If you put tidal volume as 500 cc's, the ventilator will stop once your 500 cc's have been achieved. The ventilator will figure out your inspiratory time depending on the flow rate that you are giving this patient. So for example, if your tidal volume is 400, your flow is 40 liters per minute, that's going to take 0.6 seconds, and that will be your inspiratory time that your ventilator would have calculated. In pressure assist control, the cycle is time. So you need to set the inspiratory time to tell the ventilator when to stop that inspiration. So for example, if you input your I time to be 1 second, say for example your pressure target was 20 centimeter of water, the ventilator will give you 20 centimeter of water for 1 second. If you want to put your I time as 1.5 second, you will get 20 centimeter of pressure for 1.5 second. So giving a pressure for set amount of time would generate some tidal volumes. In volume assist control, different waveform in targets have nothing to do with how the cycling happens. The cycling will still occur as per the volume input on the ventilator. That means if you put a tidal volume, for example 400 cc's, in both square and descending waveform, the vent will go to cycling phase. That means stopping the inspiration once that 400 cc is achieved. Let's understand this in a little bit more detail. Say for example, you set your target at 40 liters per minute and your cycle at 400 cc's. Your inspiratory time is 0.6 seconds. If the lungs become less compliant, for example in ARDS, since your target and cycle are the same, the only parameter that can change is pressure. So your pressure will increase if your lung become less compliant or there is an increased resistance. Similarly, if your lung become more compliant or your resistance decreases, your pressure in the circuits will decrease. Some ventilators will also allow you to set inspiratory time on volume assist control mode apart from tidal volumes. So if your cycle ends before the I time is over, the ventilator will not give you any more volume. So for example, if you put your I time as 1 second in the same scenario, you know that your 400 cc's would be given in 0.6 seconds if your flow is 40 liters per minute. The rest of 0.4 second, the machine will give you an inspiratory pause. However, you cannot decrease your I time less than the given I time. So you are unable to put 0.5 second in this setting because the machine will not reach its cycle parameter, that is 400 cc's, and you will get an alarm saying there is not enough flow. Time is the cycling parameter in pressure assist control mode. If you give target pressure of 20 centimeter and you keep your cycle parameter at 1 second, you will generate a tidal volume. Let's say you generate 400 cc's. This tidal volume will depend upon 4 components: the resistance and compliance of the circuit, and the pressure and the I time that you are providing the patient. Resistance and compliance are the part of the system, while pressure and I time can be manipulated to generate the tidal volume. When your patient is on pressure assist control, make sure that you monitor their flow time scalars. So you can see the difference between the left and right flow waveform scalars is in the first one, the pressure in the alveoli is reaching the target pressure, so flow has dropped down to 0 because there is no more pressure gradient. Or the one on the right, the pressure in the alveoli are still lower than the target pressure in the set amount of I time, so the flow is still present. This is important to note because if you want to increase the volume, in the first case, increasing I time is not going to give you any extra volume because your flow has already dropped down to 0. In the second case, increasing the I time will give you some extra volume because there was still pressure gradient between alveoli and target pressures. Increasing I time, however, comes at the cost of decreasing expiratory time, and the volume increase that you will obtain will keep on decreasing as you keep on increasing your I time. So make sure that you choose what your patient needs. This becomes important in treating patients with COPD who needs longer expiratory time, so you want to keep their I time shorter. In the first scenario, the only way to increase the tidal volume will be to increase the pressure. However, understand that plateau pressure more than 30 can result in more lung injury, so watch out for that. In the first case, your plateau pressure will be equal to target pressure because the flow has dropped down to 0, while in the second case, which is on the right side, your plateau pressures will be less than target pressure because the flow has not dropped down to 0. So in the second case, you have to perform an inspiratory pause to get your plateau pressures. Pressure support mode are flow cycled. Let's understand this. The target in pressure support mode is the pressure. So the pressure that you input is going to generate a flow, and that flow is going to be highest during initial part. That is your peak flow or 100% of the flow. The ventilator will cycle once you achieve certain drop in the flow. For example, if you put 60%, the ventilator will stop the inspiratory phase once 60% of the peak flow is achieved. For example, if your peak flow is 100 liters per minute, the ventilator will stop the inspiratory phase once you reach 60 liters per minute of flow. There's already a default flow rate set into the ventilator, which is usually around 60 to 75%, but you can change this parameter depending on your patient's need. You can already see that if you decrease the flow, you'll get longer inspiratory time and get more volume. However, the amount of volume that you are going to increase with subsequent drop in percentage peak flow will keep on decreasing as your pressure gradient between alveoli and the pressure decreases over time. So the two ways to increase the volume in pressure support mode are either to increase the pressure or to decrease the percentage of peak flow where the vent should cycle. Dropping the percentage peak flow will certainly give you more volume, however it will increase the inspiratory time and decrease the expiratory time. So the main difference between pressure support and pressure assist control is how they cycle. Pressure support modes do flow cycle and pressure assist control mode do time cycle. The fourth type of cycle is pressure cycle. You can use pressure cycle to use it as a pressure alarm and stop the inspiration. This can help prevent excessive pressure in the circuit. So for example, we have a patient on volume assist control with square waveform and you set pressure alarm at 55 centimeter of water. Let's say patients start developing mucus plug in the endotracheal tube. As your obstruction increases, your flow through that cross section is going to increase, and that's going to increase the pressure. Since your target is flow and cycle is volume, these two parameters are not going to change. As the obstruction increases, you will see your pressure increasing because you are getting the same flow through much and much narrower endotracheal tube. Once the pressure reaches 55, the alarm is going to go off. Any further increase in resistance will limit the pressure to 55. Since you cannot cross this pressure and your target is flow, the only parameter that's going to come down is your volume. So pressure cycle modes are very useful in preventing barotrauma, and they also bring your attention that something is changing in the circuit. Increased pressure in this mode can result from increasing resistance, decreasing compliance, or development of autopeep. To summarize, cycle is the parameter which the ventilator requires to end the inspiration and begin expiratory phase. In volume assist control, cycling parameter is pretty simple to understand. It's the volume. In pressure assist control, the cycling parameter is the I time. In pressure support mode, the cycling parameter is the drop in the percent peak flow rate. Thank you.